get the help you need and don't be too proud to go and ask for it. It's the best thing you can do.
There's veterans breakfast clubs, there's veterans hubs that are going on, there's loads of support.
Seek these people out, go and speak to them. They will help you.
My name's Andy Gilliam, I'm a consultant surgeon at County Durham and Darlington NHS Foundation Trust. I've worked here for over 20 years and I've been an army reservist for over 30 years. The video that you're about to watch has been made by veterans for veterans and includes some important information about support available to the Armed Forces community. Please watch it carefully.
So I'm 24 years in the army, joined at 16, left at 40, served all over the world. So I work for the NHS, and if a doctor or a worker would pick somebody up who's a veteran who they feel that's not engaging, or there could be things that are available to veterans, my role is to help them to realise that they need to engage with things like that.
So I was sat reading and I saw a thing for the military veterans. I thought, you know, this military veterans group would be an ideal place to talk about my time in the army. You know, when you need somebody to talk to who's not involved. But when you actually go to the military veterans and you get talking to them, a lot of them are suffering the same as you. And then they start to open up by talking to other veterans who have gone through similar problems. Then you get to realise how much help there is there for you. And when you're asking for help, you get help. That's an army attitude. Don't worry, you'll get through it. And then you go and lie in bed at night and you think, oh God, what's that little ache? What's that pain? Where if you talk to somebody who's in a similar situation, and then you've got these groups like the British Legion, like SAFA, like the Royal Artillery Association, all these groups are there for you. And do you know what? They're happy to talk to you.
My name's Alan Hook. I'm a veteran and I used to be with REME, as you can see from the badge, and I used to service helicopters. I lead an active lifestyle and I put that down to the sports I do and my military life. And because of that, I want to help people that are not so fortunate as me, and basically cancer has appeared without any reason. It just appears, and I'd just like to support them as best I can. Well, my role here is in the chemotherapy ward. Most of the time is making tea and coffee for everybody, and anyone that I can see that I haven't seen before, I normally ask, is this your first time here? Do you know we have a lot of services here? There's a lot of leaflets around. There's a Macmillan Centre right by the exit, and you know, if you want, I can arrange you to go in there. I've got a form here that I can fill out for you, and if you do that, you know, we can set up some support for you, because the support that Macmillan offers is quite substantial. They offer financial advice, they offer transport to and from hospital, carer support. We have wigs for anyone that suffers the hair loss. Just come in, doors are always open. There will always be a quiet and safe place for you to discuss whatever you want to discuss, and it will stay in that room if you want it to.
The hardest thing is finding out what is out there to help you. When I lost my sight, I didn't know where to turn. I didn't know who to ask. Join a group or a charity. You'll get information and help that you need. You'll also won't isolate yourself, because you'll be among other people similar to yourself. You'll find that you'll talk to other people and they'll talk to you. If anybody can say that they're lucky because they've got cancer, I felt lucky because it was found by accident. So I've come to terms with it, but I've got a lot of good friends I'm in a good charity, Blind Veterans UK, and the welfare officers there are great. They keep in touch, make sure things are okay. Doctor Surgery does as well. They have a support team which keep getting in touch, making sure everything's okay.
We're here to help and support you. There's a huge amount of resources available to the Armed Forces community. Thank you for watching.